guys, in today's video I'm going to be giving you some tips for preventing cold sores. What are cold sores? They are really uncomfortable skin lesions that appear when we're stressed out. They are caused by herpes virus infection. When we're young, oftentimes, or any time in life, we can be exposed to herpes simplex virus. And throughout our lifetime, when our immune system is challenged, like in the case of stress, illness, that virus will wake up and cause this type of skin lesion called a cold sore. Most often can happen on the lips, around the chin, or on the nose. A herpes cold sore outbreak is usually preceded by symptoms of tingling, maybe pain, itch, a little bit of discomfort, and then often the lesion will arise as little blisters that are grouped together. They then open up and you kind of get a crusty skin lesion, and then it goes away completely. Things that trigger a breakout include fever, stress, illness, having another viral infection, and sun exposure. That's something I don't think people realize, but exposure to UV suppresses the immune system and can cause that little virus to wake up readily. A cold sore can also be triggered by any type of skin injury, including certain cosmetic procedures like laser resurfacing or a cosmetic peel. The number of times that you experience an outbreak can vary substantially from person to person. Some people rarely ever have them, maybe once or twice a year, but some people find that they are having them on a consistent basis, like maybe once a month or something like that, especially if you are under a lot of stress. In this case, one thing that can help a lot is to take an antiviral medicine called valacyclovir or Valtrex. This can suppress the reactivation of that virus and reduce the frequency of cold sore outbreaks, and also can shorten the duration of time for which you are dealing with the outbreaks. It makes them last fewer days. Cold sores are in fact contagious, including the days before you have an outbreak, so when you start feeling those symptoms, and then during the duration until the lesion is crusted over and healed completely, you are shedding viral particles that can infect somebody else. So that's another good thing about seeking out treatment to reduce the frequency of those outbreaks, is that if you work, say for example, with young children or immunocompromised people who might have challenges with dealing with herpes simplex infections, then it can really be a good thing. Or if just having the outbreaks is a nuisance to you, the medicine can help. No side effects of the medication. It's very, very, very safe, super safe. There's a topical medication called Docosanol or Abreva that you can actually buy over the counter, and it can reduce the number of days an outbreak lasts, but it's kind of a pain. You have to put it on 5 times a day, and in the studies, on average, it results in a shorter duration of about 4 days. So if that's worth it to you, then using Abreva may be a good choice. Making sure you have a balanced diet is also really important, because nutrient deficiencies make you run down, they compromise your immune system and make you prone to more outbreaks. I get a lot of questions from you guys. Do I recommend lysine supplements for reducing the frequency of cold sore outbreaks? You'll hear about this. A lot of people take them to reduce the frequency. I actually don't recommend that to my patients, but if my patients are motivated to take them, I don't necessarily discourage them. There has been a lot of interest in L-lysine supplementation for preventing herpes cold sore outbreaks. In lab studies that include cells in a dish, adding L-lysine has been shown to interfere with virus replication, and in theory might help to reduce herpes outbreaks. What is L-lysine? It's an essential amino acid that we get from our diet. It's present in meat, eggs, and soybeans. And there are several studies looking at L-lysine supplementation, but the results are mixed. Some studies suggest that it has no effect on the rate of recurrence of herpes outbreaks, But it seems as though in some people it does make a difference, and some studies really lean more towards that, suggesting that there has to be something unique to an individual for them to respond to the L-lysine supplementation in terms of preventing outbreaks down the road. And so if you pursue a balanced diet, make sure that you're getting adequate L-lysine, in theory that should support that, so provided that you don't have any problems absorbing that and incorporating it. You don't have any background medical issues that make whatnot. So whether or not people who have herpes simplex need to be taking L-lysine supplements, it's hard to recommend that given the data doesn't strongly support it. It doesn't seem to be harmful. So if somebody's motivated to take them, then I don't necessarily discourage it. But when I'm seeing patients, I don't go to telling them, oh yeah, take an L-lysine supplement, given that the data is just not that strong for it. But what you guys have to understand about cold sores is you cannot cure yourself of them. That virus genetic material is part of you forever, and there's no removing it or erasing it. Treatments are aimed at reducing the reactivation, or basically the waking up of that virus from your cells. And those treatments include, as I mentioned, suppressive antiviral medications that suppress the virus in cases where you're getting a lot of reactivation and a lot of outbreaks. Perhaps topicals may help in reducing the duration of an outbreak, and having an adequate diet, but importantly, avoiding known triggers. Stress, really hard to avoid, but managing your stress can really make a difference, making sure that you get adequate sleep, and also protecting your skin from the sun. A lot of people don't realize how important that is in terms of reducing the frequency of outbreaks of herpes. I recommend wearing a broad spectrum SPF 30 or higher sunscreen every single day, regardless of who you are, and make sure you reapply it throughout the day. Even if you're indoors mostly, it's still important to reapply it because it does wear off. And for the skin of the lips, I recommend using a dedicated SPF lip balm to protect the skin of your lips. My favorite is the Vanity Cream Lip SPF. I'll list it down below for you guys. So that can really help. And again, if you're gonna have any kind of cosmetic procedure, anything to your face that could potentially injure your skin and trigger that reactivation, definitely bring it to the attention of your healthcare provider. They may elect to go ahead and give you some of the antiviral medicine in advance to reduce the risk of that. When I've told you guys in my other videos that lifestyle factors go a long way, but keeping yourself healthy really goes a long way in terms of controlling the outbreak frequency, making sure you're managing your stress, getting good sleep, and eating a balanced diet, and making sure that your diet has adequate L-lysine in it. And again, you can get that from eggs, meat, and soybeans. When you have a herpes outbreak though, it is contagious. Right before the lesion appears, when you're symptomatic, you're shedding viral particles. The virus has woken up, it's replicating, and you're shedding viral particles that can infect somebody else during that time period. So things that you want to do are to make sure that you avoid any skin-on-skin contact with anybody else. Kissing, hugging, anything like that until the lesion has gone away, to reduce infecting someone else. Definitely want to be especially careful around young babies, anybody who's immunocompromised, for sure. Don't share utensils, no sharing of the lip balms or things like that. And while you're in the throes of an outbreak, make sure you wash your hands regularly. Anytime you touch your face, go ahead and wash your hands, because it can be carried from your hands transiently and passed to somebody else. So make sure that you wash your hands consistently. You don't want to use any irritating products on the cold sore. It's okay to apply plain Vaseline or petrolatum or an ointment or plain moisturizer, but I wouldn't apply any acids or any active ingredients, but it will heal up on its own and go away. So that's what I can tell you guys about preventing cold sore outbreaks. There's no cure for them, period. I don't care what the internet claims. You cannot cure herpes. It is forever. People hear herpes and they freak out. As a dermatologist, it's one of the hardest diagnoses to give to people because they get a look of fear automatically. But it's really, really common, and it's something that we get most often when we're young. It's pretty ubiquitous in our environment. Chances are you have it, and you may not even know about it. That's the other thing. So many people have herpes and have no clue. They just happen to never experience outbreaks. And so chances are you have it, or you've had it your whole life, and maybe you're experiencing an outbreak that you realize for the first time. But it's actually pretty common. A lot of people mistake herpes outbreaks for other things like pimples. I've even seen this on TikTok, actually. People who have textbook cold sore thinking that it is due to a product. Maybe the product was irritating and triggered an outbreak, but it's a pretty classic textbook cold sore. So yeah, a lot of people will mistake cold sores for other skin lesions, like acne or something like that, but no. And so like I said, a lot of people don't even realize that they have it, and people get super freaked out when they find out they have it. It's pretty easy to diagnose just by looking at it in most cases, and we can take a little swab of the skin lesion and send it for a test to look for the virus and to establish the diagnosis. So it's something that is very, very common. So if you have it, don't be freaked out or ashamed. There's a lot of stigma around herpes when there really shouldn't be. Most people have it or have some herpes virus. Most people do. It's very ubiquitous. So if you've had to deal with a cold sore, don't be embarrassed about it. Shouldn't be the kind of, I see a lot, I'm really happy, as a side note, I'm really happy that there's like a move to embrace different skin conditions like acne, vitiligo, eczema. Like, people are openly sharing those things and like not covering them up with makeup. It's more being celebrated as our individual differences. I wonder if we'll see that for herpes cold sores. It carries so much stigma. I see people getting shamed about it all of the time on social media. So shut that down. Don't shame people for something that one day you might find yourself not feeling so great, and then boom, all of a sudden you see that you've had it your whole life too. So yeah, don't shame people for having something that common. I do see a lot of ha 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 about it, and yeah, don't. Anyways, guys, I hope these tips were helpful to you all and this video was useful. If so, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.